Heart disease can affect the human body in many different ways. What's important for us to remember is how the system itself works. So the heart is a muscular pump, it's an engine. It has a plumbing system and an electrical system. So diseases of the heart can afflict any of those systems. What's important about most all of these diseases of the heart is that most of them can be thwarted or stopped or even prevented with simple, easy primary prevention. We know that if these things are started even in the teenage years or younger, we can really probably put people like me out of business someday. Heart disease, again, being a disease of multiple types involving arteries, electricity, and also the pumping function of the heart, is most commonly affected by things we do during our life rather than strong genetic predeterminants. Now, that's not to say one is more important than the other, but there's some things we can know about and not change, such as our age and our family history, and there's some things we can know about and affect and change. These are easy targets to focus on and be active and controlling in order to get ahead of yourself and prevent heart disease. Heart attack signs, real important. Remember this, tell your mom, tell your brother, tell your sister, tell your neighbor. The words to remember are easy, nose to navel. So anything between here and here. We know that only about 50% of both men and women, sometimes more commonly in women, do not have typical symptoms of heart attack, crushing chest pain, things that you learned about in school perhaps. But we do know that a lot of patients experience something, nausea, jaw pain, something up in the throat, things like this that are predicting a heart attack or something's going to happen. About 80% of patients with heart disease would have been easily preventable. The most common ones are sedentary lifestyle, tobacco smoking, or smoking in general, cholesterol, and diabetes. All of those things are not written in stone. What else we find these days, I'll have patients come in and say, Dr. Anderson, my mom had a heart attack, so it must run in my family. Well, what's also common is that people are sedentary, that can run in families. People smoke, that can run in families. And people may not have access to healthcare. So those things can run in families. So it's very important for us to kind of pull those things apart and listen to our patients as we talk about risk of heart disease. My top recommendations to a patient or a friend who is at risk or concerned they're at risk for heart disease is get engaged, meet somebody, go online and access a tool. Some great tools are American Heart Association, so AHA.org, Life Simple 7, assess your risk, see yourself, are you at high risk or not? Chat with a provider, get in touch on the portal, phone call, or make an appointment. I have patients that come in once in a while that ask me about risk. I wish we had more, because that would be very easy to do. For me to prevent heart disease is less costly, more helpful, and a much better outcome than treating a patient with heart disease. It's something that saves lives every day.